Hello, Facebook friends. I'm with Dr. Kanika Cunningham. She is the health director of St. Louis County, and I'm in the Animal Control Center here. That's also falls under the health department. Kanika?
Kanika, right?
Okay, Kanika. That's it. Okay, I got it.
Thank you.
Thank you. But I'm in the Animal Control Center. Basically, we're going to talk to you about the controversy that surrounded the a document, apparently, that was circulating that talked about some mass euthanasia of animals. It was the subject of a lawsuit, and the higher-ups, St. Louis County Executive and Dr. Cunningham, were both asked about it. At first, they denied it, basically, that anything like that was going to happen. But the Post-Dispatch dug up a document that seemed to indicate that somebody, somewhere in the organization, had in fact talked about euthanasia of animals. Doc, the first thing, how you doing, first of all?
Good. How are you?
Pretty good. First thing I want to do is I'm going to put this on you. Good.
Let me hold it or? Okay.
First thing, did you and Dr. Page try to mislead county residents when you said there was no such plan to euthanize the animals?
No, there was no misleading. Dr. Page, I have been keeping him updated since the announcement of the contract ending. He was well aware that my intention and my goal was to follow evidence-based research with this, look at best practices, talk to other health departments and other animal welfare organizations. And then additionally, APA did also offer their operations playbook to us. And so this was never a consideration. It was, an employee that made a suggestion, and that suggestion was quickly dismissed. And then, the week and a half before it's time for us to resume operations, there was, I guess, a small few that wanted to try to sabotage this process.
But that's not what at first, though, when you were first asked about it, you said, there's no ideas like that floating around here.
Correct.
That's what you told the public. And so you really led the public to believe that now nobody here was thinking about anything like that, yet there was, in fact, a document circulating talking about mass euthanasia. Mass euthanasia, but you guys didn't say that. Didn't you kind of, like I said, didn't you kind of try to mislead the public?
No. So there was no plan. What came out was, there was this secret plan. It was some suggestions. Employee brought that, and that was dismissed, and that was it. It was one meeting that came up, and that was the end of that. Nothing else happened beyond that. And so there was no misleading. That was not the plan. It was suggestions, and that was that. And I will say that I have said that in the past, those were practices that the health department followed. I was completely upfront with that. And I also said that I was completely upfront with saying that we're not going that direction anymore. The 2019 audit highlighted significant issues for the animal shelter. I read that audit, I read the recommendations, looked at the best practices, and I made it clear that that is not what we're considering, that's not where we're going, and that was in a discussion.
Who came up with this plan?
Yeah, I don't know if I can say which particular staff member, but it was some staff, long-term employees, who offered a suggestion. This was in the process of us putting a plan together. They wanted to present some suggestions based on how the animal shelter was ran before, and that was that.
A plan for mass euthanasia.
And unfortunately, the health department did engage in that before me. That is a fact.
So why didn't you just say that in the beginning? Yeah, a worker came up with a plan for mass euthanasia. No, at first.
No, I did.
At first, the word coming out of the administration was no such plan exists.
Correct. Is that a plan? It's suggestions that was given to me. Is that a plan?
But do you regret the way you handle this? Do you regret not being more forthcoming at the very beginning and saying, because you guys didn't acknowledge that a worker in fact came up with this proposal and it was floating out there and you had seen that proposal? Do you regret how you handle this?
So are you...
Could you have handled it better? Let me ask that question.
Right. So are you basing this only on the Post-Dispatch article? Because I did other interviews in which we were upfront with acknowledging it was a worker with suggestions and moving forward. So I don't know if you're basing this only on that particular Post article that was misleading, but other interviews and stories that came out, I said that up front. Unfortunately, with the Post article, I was not interviewed, I was not talked to, and that was an article that was put together without my input, without my thoughts with it. So saying that, I want to answer your question, looking at the big picture with this, no, I don't regret it, because on those news outlets, other outlets, I was upfront about this, and I've always said that it was an employee who offered a suggestion that was dismissed, and that was that. But it was never a part of the plan that we were putting together.
But you guys kind of admitted that. You did later on say there was that proposal, but that was after the Post found the document. And
No, there was not. This was not a proposal. It was suggestions, and it was not a proposal. It was not. If you look at it, it's not a plan. That's not anything that's comprehensive. And I think that's the thing that people keep saying, that this document came out of the department. It's not a plan. It's not a proposal. It's suggestions. Even the word "suggest" is used in that. Employees presented that. I said no, and then we moved forward with actually making a plan that should be acceptable to the community and making sure that we take care of the pets.
Why did the county take over from APA when the reason that you guys got APA in the first place was the county did such a bad job running animal control? Why do it?
Yeah, that's a fact. That's a fact before. I would say what happened, I think APA achieved their goals early on. I think we were in a great spot, that we learned a lot from APA. APA learned from us as well. I think it went both ways. I think one of the things that's unique when you have an animal welfare organization working with a public health department, on both ends there's educational opportunities. So I think that we achieved the milestones that we needed to, and APA wanted to expand their footprint into North County. We want to support that. We want to do more in North County. So I think it made the most sense, and we came to an agreement with that.
APA did a good job, didn't they?
They did, yeah. APA did. They did a really good job. We worked closely with them with operations plan. Their playbook that they share with us is phenomenal. That is what we've been using. They cleaned up the shelter. It's nicer. Helped us get new SOPs in place. They really did. I'm grateful and thankful for the opportunity to work with them, and they've been continuous great partners even during this transition.
They did a better job than the county had done, right?
I agree.
So if they did such a good job, they did a better job than the county. Why?
I would say a better job.
Why make a change? If you're saying they did a good job, why make a change? Why not keep them?
So I would say a good job. So two things. The health department, we still do our community work. And so with our ACOs, getting strays, bite cases, that's public health. APA, they do a great job with the animal care in the shelter. So they did a great job running the shelter. The other thing, I can't exclude the DPH team, who did a great job at the community work that we were doing, decreasing the stigma as it relates to ACOs, looking at our ordinances, making sure that we are adopting the most appropriate ordinances. So there's been some ordinance amendments as well. So I think collectively, I do believe both sides have done a great job. But if you separate out who was responsible for what, then yeah, I think both did a great job.
So you said APA did a good job, but you guys kicked them out anyway.
We didn't kick them out. That's not true. We didn't kick them out. Again, they achieved their milestones. We achieved ours. And even so, they left their playbook. They left, everything for us so they can expand and go a different direction. And we departed in peace.
Let's talk about the volunteers. You guys kicked out the volunteers and said you're going to revamp the program. You're going to revamp the program because you wanted to make it more equitable. You want to bring more minorities into volunteer effort?
So what I said, well, first off, I didn't kick out volunteers. The volunteers were APA volunteers. So just like when APA started, the volunteers had to apply to be an APA volunteer. So the same thing for us, they have to apply. No, the same thing for us. They have to apply to be a DPH volunteer. So the same transition took place. The volunteer program, it started. What I said was diverse, and I think people took that to mean black or white. When you say diverse, it's not just talking about only race. It is looking at gender. It's looking at whether able-bodied veterans. Diverse is not only black or white, and I think unfortunately because diverse is becoming politicized, people will automatically assume, this person means black or this person means white. It does not mean that. It's truly comprehensive to make sure that we are reflecting the communities that we serve.
Do the dogs care that there's a person of color or a veteran or a disabled person walking them? Does it matter to the dog?
No, of course not. Dogs do not
care.
care.
Why even do all this?
Because it's about people. It's centering people and pets, and there are people that deserve the opportunity to be able to volunteer or deserve at least access to the opportunity. So it's about people. And I think people started saying that, oh, it's pets, it's pets. No, it's about people. We center pets. We want to make sure our pets are taken care of. But when I said that statement of diverse, it's about the people in the community. It was never focused on the pets. And if we help support our communities that may have not received the education to be able to care for their pets in an appropriate way, we can limit the amount of animals that come into the shelter. So that it was a comprehensive approach to engage the community as well as engage the pets and not leave out any communities that may want to be involved.
Did you have any minorities that came and wanted to be a volunteer that were turned away?
No, so I did not. So I would say this, on our screening application, we didn't ask any questions related to gender or race or anything like that. What we were looking for was someone who was willing to be committed to the time commitment, someone who was willing to provide honest feedback with the program. We have a diverse level of experience types, some that are completely inexperienced, intermediate experience, and advanced experience. I wanted the experience. So as we go through this pilot, if you're a beginner, never walked the dog or never played with cats or never did any of this, I want to get their feedback. I want to know, hey, what we have in place, do we help you in a way to be able to feel empowered or supported to continue to volunteer at a shelter? And then some of our advanced volunteers, they have great feedback. Actually, a lot of them have given me feedback already about the program or how we're running the shelter. I always accept feedback. So the advanced volunteers, we have some that was here with DPH. We have APA, and now they're back with us again. Their insight is going to be valuable at helping me to truly reshape our volunteer program. Because again, the 2019 audit, it highlighted significant issues in our volunteer program. And what happened, APA came, it was their program, and now we have an opportunity to do a new and different program.
You didn't say there was anybody who claimed they were discriminated against, that they came, they wanted to volunteer, they help animals, but they were turned away. You have any complaints like that?
No, at least nothing have came up to me, and no, there shouldn't be any complaints with that. Now, people who applied, and once we get our 60, there is a wait list. So if people decide to drop out or no longer participate, we will start going back to that wait list to bring people in for orientation.
So was this a solution in search of a problem?
What do you mean?
In other words, nobody was complaining about discrimination, but you wanted to revamp the volunteers because you wanted to make it more diverse. So it really wasn't a problem to start with, right?
No, so the problem was the volunteer program itself in St. Louis County. So based off the 2019 audit, it highlighted significant issues with our volunteer program. So the thought to revamp it came from the audit recommendations because we never had an opportunity to address the volunteer program based off the 2019 audit. Not only that, I was also talking about creating a county employee volunteer program. So it was going to have two programs, one for community, one for county employees. So that was the whole revamp of the volunteer program because that never existed like that. That's where that came from.
Are you guys giving any thought to giving the program back to APA because of all that's happened? Would that be a better approach? Just give it back to APA, let them run it, and everybody is happy.
No, I appreciate APA. I truly hope that people give us the opportunity to run it. It's unfortunately the events that took place leading up to this had a lot of staff that was excited about the new direction. I was talking a lot about this, and unfortunately that incident took place. I'm truly serious about mending relationships with volunteers, with community members, but no, as a health department, I do want the opportunity for us to lead in this space and for people to see that we truly care about pets and people. And thankfully with a health department, we already do a lot of great work with people addressing health disparities, addressing those health inequities. Now we can shift and also start to address some of those that we see in certain communities when it comes to pets. Pet food insecurity, that's a big one. Access to veterinarians, helping people understand the importance of spay and neuter and vaccinations. Those are all community education topics that we as a health department, we didn't do that in the past. So it's going to be a lot with educating the community, empowering the community, helping people to either maintain their pet or become new pet owners. That is a direction that I am trying to go, following a socially conscious sheltering framework.
You have to admit this has not been handled well, correct?
I believe this was handled well until this incident that took place.
That was
It's
bad
unfortunate.
enough.
It was bad, but that doesn't mean that I need to give up. That's not what we do. That's not what the team do. We do not give up. I think in time, people will see that we were genuinely, there was a genuine interest to make the program better, to get all of our resources to have a different mission and vision for the animal shelter. It'll take some time, but I hope people will give me and my department, our department in St. Louis County, the opportunity to do something different. And what I've said, we have that audit, we have the experience of APA, we have the tools and resources we need to create an award-winning, even better shelter than it was before. So give us the opportunity to do it.
How do you react to the lawsuit?
I can't respond to the lawsuit, of course, from legal guidance, but I think my only comment I think is unfortunate. I can't say too much because it is litigation, but I think it's unfortunate.
Prop B is going to be on the ballot. That's going to give the council power to fire department heads like yourself.
Correct.
How do you react to Prop B?
Yeah, I think it's, of course I don't agree with it.
Why?
Why don't
you agree with it?
Yeah, I to be completely honest, it's dysfunctional to respond to 8 bosses. Coming to this job, I know that we are considered political appointees, but what people don't know that as directors, we do a lot of collaboration with each other. We truly care about the communities that we serve. We truly care about county employees. There's a lot that take place. The group of directors that I am a part of, we are a passionate bunch, and it's unfortunate that we are being thrown in the crossfire because we are appointed. And I would say for me, coming into this position, there's quite a few things that I even look for in a boss. I don't think it goes one way or the other. When you interview for a job, I hope you don't just interview and say, oh, I want this job, but your interaction with the person that's interviewing you, your interaction or reading about the business. But for me, I look for certain qualities in a boss as far as being able to feel empowered, to be a leader, to be able to disagree or agree, to be honest about my opinions or my assessments and not being put down or micromanaged. And that's something that I would say that I am experiencing. A lot of my directors, we get great support. There are also conversations that your boss is only privy to that 7 or 8 people may not need to be privy to that. So of course, it's going to be chaotic for county employees, and I think it's unfortunate this is happening to the directors, the police chief, as well as the county councilor.
This would not include the police chief.
No, it does.
As I understand. I talked to Councilman Dennis Hancock, and he said it does not include the police chief, that the police chief would still report to the Board of Police Commissioners. So that's an error.
No, it does. Even the police commission actually put out a statement in opposition to it. Unfortunately, I know that there's a debate that it doesn't include. It does. It includes the county council, the police chief, as well as all of the department heads. And that's the police commission. They put out a statement. They are strongly in opposition. And unfortunately, I think that's misleading to say that it does not include the police chief when in fact
That's
it does.
what Councilman Dennis Hancock said,
Yeah,
that it does not include the police chief. But we won't get hung up on that one. You don't think the council, their bosses too, you don't think they should have a say that if Sam Page does not just think that they should get rid of a department head, that the council shouldn't have a say with 5 council people voting? So it's not like you're answering to all 7. Obviously, the council as a unit would have to vote to get rid of a department head. You don't think they should have that power?
Elliot, that's going to be dysfunctional. What if they disagree with something you say? And to be a leader or department head, just the idea of, oh, I can be fired at any moment with or without a cause because I disagree with someone. I don't think any leader or any director, anyone, whether you're a manager or supervisor, want the thought of being fired dangled over your head because you disagree. And I get what you're saying, but in reality, having one boss, I think there's something as far as if you have a concern, and even in the private sector, you go to that supervisor with the concern that you observe in that employee. You don't have 7 or 8 bosses to report to at one time.
But a lot of communities, they can kick out the mayor, for example. The Board of Aldermen has that power to impeach the mayor, throw him out the door. We have that power nationally where Congress can vote if they get enough votes to
That's elected officials, though.
to impeach the president and throw him out the door. So, and they've got, what, 400 and some bosses or whatever the case, I guess you could say. But in this case, don't you think there needs to be additional power for the council to maintain the checks and balance? Give them power over somebody that maybe the public has lost confidence. Do you think the public has lost confidence in you?
I hope not. I would say, I've people have told me some of the comments that's being stated. It's unfortunate that a lot of the people that's commenting don't know me. I will also say talk to some of the volunteers. Some of them have reached out to me. I've built relationships with them. Initially, they were coming to the council meetings talking about me and, you know, saying all sorts of things. And look what has happened with that I've built a relationship with them. I don't think anyone's pointing that out or highlighting that as how did that come about. There's no tension there. And now we're starting our volunteer program, and they have been phenomenal with helping me even get to this point. And so I don't even think people are seeing that part. But going back to the example that you gave, those were examples of elected officials. I'm not an elected official. I'm not a politician. I am a physician. I'm a mom. Yeah, that's not me. I didn't get into this role to be a politician. I got into this role to serve St. Louis County because I'm passionate about public health. I'm passionate about health. That is why I'm here. And people need to talk to me to find out what are my priorities, what am I passionate about. And it's unfortunate to get thrown into a political fire because there's a battle there.
Many people who have jobs have more than one boss. I had more than one boss when I worked for Fox too. How was that unusual?
It's definitely unusual. You have one, so whoever is doing your performance evaluation is one person. You may have a hierarchy as far as leadership goes, but
they have a boss,
but when it comes
and their
to
boss is your boss too.
Right, but when it comes to who's working with you directly, there's one boss that you talk to, and then there's higher ups. But when it comes to respect and hierarchy, you go to that boss. Now, if there's any concerns about you as an employee, then that needs to be discussed with your supervisor or whoever your boss is.
Well, if your boss's boss tells you to do something, you're going to do it. Plain and simple.
Well,
I would.
I don't think
if the general manager came to me and said, "Elliot, I need you to do something," am I going to say, "Sorry, I have to talk to the news director"?
So let's really
She's
talk
the only
about
one that can say something.
Healthy
You
work
can't say
environments.
anything.
No,
Okay.
seriously, let's talk about healthy work environments. I think that's changing. I would not want to work for anywhere, any place to where my opinions are not valued. I am not going to be dictated or told to do something. If I am when I say I'm just saying whether I'm a manager, whatever place, McDonald's or Starbucks, whatever the case may be. If I'm doing whatever, the task to carry out, and somebody come and say, "Hey, I need you to do this," but I think that, well, you know what? There may be some problems with that. How about we consider X, Y, and Z versus A? I can still get to your solution, but let's try it a different way. And I think that's what's changing in the workforce is, no, as leaders, don't dictate or say, oh, you need to do this. Create opportunities for employees to be able to either make mistakes or to be able to problem solve or disagree with you and present an alternate plan or solution. That's a healthy work environment, not being dictated and told what to do. I would not work for any place in which my voice was not valued and I was not heard, and I do not have the opportunity to disagree with my boss or boss's boss. That's not a healthy work environment.
Finally, look, given how this thing is blown up and some public pushback, are you giving any thought to stepping down?
No, not at all. I love what I do. I came here to serve the people. There's multiple things that we are addressing in the public. I love what I do. I love my job. I love serving people, and I'm not. And one thing that I will stand firm in knowing and saying is that this was an unfortunate event that took place. I believe in myself. I believe in God. I believe in the direction that I'm going, and I know where we're going to go as an animal shelter, but even as a public health department. The vision has been set. We are going to get there. There's ups and downs that come along the way, but we are continuing to progress forward.
And no plans for any mass euthanasia of the animals.
Correct. No plan for that.
You're not going to endorse that.
No, not going to endorse that. There's no plan. There's nothing with that. We will follow humane euthanasia. We will function under the framework of socially conscious sheltering. As a public health department, we are a public shelter. We
Let me
cannot
just interrupt.
turn.
You said follow humane euthanasia. What do you mean?
Correct. So humane euthanasia, what that means is that there's a space for euthanizing animals, whether they're dangerous animals, dangerous to the public when it comes to public safety, or for poor quality of life. So it's the same thing that we did with APA. That is not going to change.
Doc, thank you.
Thank you.
All
Thank you
right.
for the opportunity.
Okay. That was Dr. Kanika Cunningham, got it right this time, basically addressing the controversy that has been hitting St. Louis County Animal Control. You've heard all of our answers. No need for me to expand on anything else. But, of course, we're going to stay on top of this issue that's impacting a lot of people and has a lot of folks talking. My Facebook friends.